Hey guys, welcome back to our channel Mother Baby Care. Today's video is about 8 common tests during the third trimester of pregnancy. So let's start this video. Your doctor may recommend certain diagnostic tests during the third trimester of your pregnancy to ensure the well-being of you and your little one. You will be offered many tests throughout your third trimester depending on your age, health, family, medical history, and many other things. These tests help identify any potential issues and ensure safe and healthy delivery. The tests which are common and you might receive in the third trimester of pregnancy are: first, Group B streptococcus screening. Group B streptococcus (GBS) is a bacteria that can exist in the female reproductive tract. Around 30% of healthy women can carry GBS. However, it usually doesn't cause any problems, but in some cases it can lead to infections such as urinary tract infection, placenta infection, or bloodstream infection. It can also have serious consequences for the baby, which causes life-threatening infections in the newborn such as pneumonia, meningitis, and sepsis. This screening is usually done between 35 weeks and 37 weeks of pregnancy. During GBS screening, a sample is taken from the vagina and rectum with a cotton swab. After that, this swab is cultured in the laboratory to find out if Group B strep is present. If the test is positive, your doctor will give you antibiotics during labor to reduce the chances of infection in the baby. This test will be done in a subsequent pregnancy even if you get a negative result in your first pregnancy. Second, electronic fetal heart monitoring. This test is done to monitor the heart rate of the fetus during pregnancy, labor, and delivery. The fetal heart rate signifies that the fetus is doing well or is in trouble. It is usually done to ensure your baby's health, and this monitoring can be done anytime after 20 weeks of pregnancy. Third, ultrasound. An ultrasound is a test that uses sound waves to make images that show your baby's position, size, and shape in the uterus. An ultrasound exam may be performed during the third trimester to examine the position of the placenta, monitor the baby's movements, evaluate fetal growth, and determine the levels of amniotic fluid. Pregnant women with high-risk pregnancies may have multiple ultrasounds during the third trimester. Fourth, glucose screening. Glucose screening checks for gestational diabetes. Gestational diabetes is a short-term form of diabetes that develops in some women during pregnancy. If it is not diagnosed or treated properly, it can cause serious infections in newborns. For this test, you will have a sugary drink, and then after an hour, your blood sample will be taken to check your sugar levels. Fifth, non-stress test (NST). The NST is a common test performed in the third trimester to assess the baby's heart rate in response to its own movements. It helps to determine the baby's well-being and can aid in identifying any potential issues. This test can be done anytime after 28 weeks of pregnancy, but it is mostly done after 32 weeks of pregnancy. It is a non-invasive test that checks your baby's health by monitoring your baby's heart rate for a 20 to 30 minute period. Sixth, biophysical profile (BPP). BPP is another test that is performed during the third trimester of pregnancy to check your baby's well-being. The BPP is a comprehensive test that combines ultrasound and NST to evaluate your baby's well-being. It assesses fetal movements, muscle tone, breathing, amniotic fluid volume, and the baby's heart rate response to movements. The BPP is often used in high risk pregnancies or when there are concerns about the baby's health. Seventh, cervical length measurement. For women at risk of preterm labor or with a history of preterm birth, a cervical length measurement may be performed using ultrasound. A shortening cervix can be an indication of an increased risk of preterm delivery, and this test helps identify those at risk. 8th, urinalysis. Urinalysis is performed during prenatal visits to check for protein and sugar levels in the urine, which can be indicators of gestational diabetes or preeclampsia. So these are some of the common tests that a pregnant woman go through during the third trimester of pregnancy. Remember that these tests are offered to you, but it's your choice whether to have them or not. Talk to your healthcare provider to decide which tests are right for you. Also, ask about the risk, benefits of the test, and the reason why it is recommended to you. It's essential for pregnant women to maintain regular prenatal visits and follow their healthcare providers' recommendations for tests during the third trimester. These tests are essential for a healthy pregnancy and a successful delivery. So, follow your healthcare provider's guidance for the best possible outcomes for you and your little one. So that's all about today's video. If you guys have any questions regarding this topic, you can ask them on the comment section. To know more on this topic, you can click on the link given in the video's description box. Visit our website www.motherbabycare.in and also like our Facebook page www.facebook.com/motherbabycare.in. Like, share this video and don't forget to subscribe our channel Mother Baby Care. Thanks for watching this video.